Okay, so last time we met, I mentioned the Radicals trial to you and gave you an information sheet. Perhaps I'll just run over the basics again and then give you a chance to ask any questions. So you've got a rising PSA now, a couple of years after your operation, and we know that the standard treatment that you need is radiotherapy. And we also know that there's a good chance that the radiotherapy will cure you, but by no means a guarantee. Now, we've reason to believe that if we give hormone therapy as well as the radiotherapy, that it might improve your chances of cure, but we don't know that for a fact. So the Radicals trial will compare, in men like yourself, giving radiotherapy on its own with giving radiotherapy together with a course of hormone treatment. And furthermore, if you're allocated to radiotherapy together with hormones, the trial will compare two different durations of hormones, either radiotherapy plus a short course, 6 months of hormone treatment, or radiotherapy plus a long course, 24 months. So now perhaps I'll give you a chance to ask any questions you might have.
Yes, you've spoken a little bit about side effects from radiotherapy. What concerns me is if I have the radiotherapy followed by the hormone therapy, I'm going to have a double dose of side effects, and that does concern me rather a lot. And I wonder if there's any sort of counselling or psychotherapy that I can receive should I really get hit by some nasty side effects from both those treatments.
You're quite right that hormone therapy can have side effects, and if you're allocated to the combination of radiotherapy and hormone treatment, you'll actually get both treatments at the same time, not one followed by the other. So you start off with hormone treatment and the radiotherapy comes in usually 2 months after the start of the hormones. Now, as far as the side effects of the hormone treatment are concerned, the hormone treatment gets rid of your male hormone, gets rid of your testosterone, and that leads to a temporary menopause. So the side effects are all temporary. When the hormone treatment finishes, your testosterone levels come back to normal and the side effects wear off. But whilst you're on the hormone treatment, while your testosterone levels are low, then you may notice loss of sex drive, you may notice less energy than usual, possibly hot flushes, possibly weight gain, and a number of other rarer side effects. The picture is typical of a menopausal type picture. Now, if you are particularly averse to those side effects, which I could understand, then what you might like to do is take part in a two-way comparison rather than the full three-way comparison. So you may feel that 24 months of hormone therapy is too long. You wouldn't be prepared to put up with the side effects for that long.
I thought the trial was randomised and you would be sort of put on to either 24 or 6 months at total random and not be able to choose which arm you went on.
So the choice you do have is whether to take part in a three-way randomisation or a two-way randomisation. So if you are open to the possibility of being allocated either to radiotherapy alone, or radiotherapy plus a short course of hormones, or radiotherapy plus a long course of hormones, then you can take part in the three-way comparison. But if you're very averse to the side effects of hormone treatment and you wouldn't be willing to have 24 months treatment, then you could choose to take part in the two-way comparison, and then you'd be allocated either to radiotherapy alone or to radiotherapy plus 6 months of hormones. And that way you could guarantee that you wouldn't have to put up with 2 years of hormone treatment. The opposite is also true. Supposing you feel that you really want to have some hormone treatment to maximise your chances of an effective treatment, and you really don't want to have radiotherapy alone. If that's the situation, then you could take part in a two-way comparison between the two different hormone durations. You'd have your radiotherapy, and you'd either have 6 months or 24 months of hormone treatment.
Could I just have hormone treatment?
So for men in your situation with a rising PSA after surgery, there's only one treatment that has been proven to cure prostate cancer, and that's radiotherapy. Radiotherapy is the only treatment that has been proven to decrease your chances of dying from prostate cancer. It's the only treatment that has been proven to improve your chances of long-term survival.
So I've got to have the radiotherapy.
So I would strongly advise you to have the radiotherapy. Whether you decide to take part in the Radicals trial or not, if you've got a rising PSA after surgery, then the standard treatment is radiotherapy. So hormone treatment on its own will likely control the cancer for many years, but we don't know whether it will cure the cancer. And in fact, in the trials that have been done, where they've compared hormone therapy alone versus other approaches, actually the men who got hormone therapy alone sometimes did less well than those who got standard treatment.